Hello, I'm Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Kara Knightley and I am 39 years.
How may I address you?
Please call me Kara.
Okay, Mrs. Kara. Today we are going to discuss about your health issues. Will that be all right?
Yes, doctor. Regarding,
During our discussion, I might. Yeah, okay. During our discussion, I might take down some notes which will be strictly confidential. Is it okay?
okay, doctor, no problem.
Yeah, yeah. Well, Kyra, can you please tell me in your own words what have brought you here today?
Actually, doctor, I didn't find any specific problem, and you know that I am having some weight issue. I am overweight, that is severe overweight, and that wasn't something problem for me. But recently, my mother had a heart attack and she is also overweight. So doctor said that it may be the heart attack may be related to her overweight. So I was somewhat frightened and I visited my GP. He said that my overweight is more above the normal level. My weight is more above the normal level, and also at the time, as my mother had a heart attack, she ran some blood test and said that I have somewhat called going to have diabetes. He said that I am not diabetic, but I am going to have diabetes. I am high risk for that. And also, he measured my blood pressure and said that I have high blood pressure. So he started one medication for me, that is Remipri. And also, he ran some blood test to find out the cause for high body weight, that is called a thyroid function test, and also he did some blood count. That blood count was normal, and did some liver function test, some kidney function test, but these were normal. Actually, I am worried that is my problem related to any underlying condition. I am not bothered with my overweight, but I am extremely frightened that if I have any other condition that is causing me overweight, or that is that can lead me to heart attack or any other serious disease. So I am here actually, doctor.
I get it. I get it. Well, Miss Kyra, Mrs. Kyra, may I just know that you told that you were overweight, but may I just know that from what age, from when actually you started to gain weight? Can you remember?
Uh, Truly speaking, doctor, I was a healthy baby, and from my childhood, I was somewhat a good health. I am
Okay.
again, I am gaining weight as time passes. For last year, I gained about 5 to 6 kg.
Okay. Okay. That's all right. And okay. May I please know that about your food habit? How many meals, main meals do you take? How many snacks do you take per day usually? Can you please tell me about it?
Uh, Actually, doctor, I am a office clerk and I am usually very busy at my office, so I cannot take my food regularly and take my meal regularly. So whenever I get time, usually I feel very hungry and I have to take more than usual food. But in my off days, I usually take 3 to 4 meals.
3 to 4 meals. Okay. Can you please elaborate what are consisted? How are the meals consist of? What do you eat for your meal
Uh,
usually?
I,
Dietary fiber, fruit, vegetables.
my office work is 5 days per week, and during my
Yeah.
office hour, I usually need to take food from the outside or from the restaurants. Some
Okay.
chicken, burger, sometimes pizza, somewhat fast food.
Okay.
I cannot take healthy meal because that is rare in my area.
Okay, okay. And during your homestay for 2 days weekly,
Yes,
what do you
I
have
usually
usually?
try to take healthy foods.
Okay, okay, I get it. And may I know that these are actually some personal questions that do you smoke?
Very little, doctor.
Okay. And do you drink alcohol?
Very occasionally on the any festival or any special occasion
Okay,
only.
that's all right. That's all right. And may I know that in your off days, do you try to take vegetables, fruits, or dietary fibers more?
When I am at home, I usually try to get that.
Okay, okay, that's all right. That's all right. Well, may I know that do you have any weather preferences?
No,
Okay, any racing and pacing of your heart, or any sudden stopping of your heartbeat?
no.
You ever noticed? Okay. And well, may I just ask? It's another personal question. What about your menses?
For recent few months, it has become somewhat irregular. Sometimes comes every 2 to 3 months, and also blood is somewhat less than normal. Otherwise, I was
Oh,
fine before that.
okay, that's all right. Well, may I know? It's again a personal question. Have you been on any pills?
No, doctor.
Okay, and again a personal question. Have you ever tried to be pregnant?
Yes, doctor. I have two children. And,
Okay,
one is 12 years and another one is 7 years.
and one is okay, that's all. That's all right, and that's all. And do you have any history of pregnancy loss?
No, doctor.
Okay, that's all. And well, now let's come to some other questions. Well, do you have any chest pain?
No,
Any racing and pacing you told before?
no,
Any swelling in your legs?
no.
Any shortness of breath?
Not actually. I didn't notice anything. Just
Okay,
somewhat when I do any severe exercise, then I feel a of shortness of breath.
okay, okay, okay. Well, have you? Whom do you live with? May I know?
I'm living with my family, doctor, my husband, and my children.
Okay, okay, okay. Well, have your husband ever noticed that you snore at night, or any disturbance in your sleep?
No, he didn't mention anything like that.
Okay, and do you feel that you are sleepy during the day, or do you have any problem at your work due to your sleep? Do you think?
No, nothing like that.
Okay, and okay, that's all right. Do you have any morning headache?
No,
Okay, any changes in vision?
no,
Okay, any racing? Okay, and any soreness in any parts of your body? Any soreness in your mouth?
no,
Any rash anywhere in your body?
no, doctor.
Any skin condition anywhere in your body?
No, nothing significant.
Okay. Well, do you think that there is any extra muscle bulk in any part of your body, or do you think that it's in your whole body?
I am healthy baby from I was healthy baby in childhood, and I am also like that. I think it is
Okay.
a fluffy
Okay. Okay.
all over my body.
Okay. Okay. Well, do you have any joint pain?
No,
Okay. And do you have you ever felt any weakness in any part of your body?
no,
Any abnormal sensation in any part of your body?
no,
Okay. Any loss of consciousness?
no.
Okay. And what about your water work?
It's fine, doctor. I didn't notice any problem.
Okay. Okay. Your bowel movement?
No problem with that.
Okay. Have you noticed that there is any changes in your hand gloves or shoe size or hair recently?
No,
Any problem with sweating? Have you noticed?
no, nothing significant.
Okay, 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 okay. That's all right. That's all right. And that's all right. And okay. And may I ask you some other questions? So you told that you have been overweight, and recently your doctor has told that you might be suffering from diabetes in the future, and also have some high blood pressure. Do you know of any other diseases of yourself?
No, doctor.
Okay. And may I ask about your medication? That are you on any medication except your
Uh,
pills?
my doctor gave me Remipryl for my high blood pressure, and he said that controlling my diet and taking some advice from the dietitian would be able to
Mm.
control my
Mhm.
sugar level, blood sugar level. So he didn't give me any medication, extra medication for that.
Okay, 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 okay. I get it. And well, are you allergic to any medication? Do you know of it?
No,
Any herbal medication?
no, I don't take this.
Okay, any over-the-counter medication?
No,
May I know? It's again a personal question. Do you take any recreational medication?
no, doctor, never.
Okay, that's all right. And may I know that what you do for a living?
I'm a office clerk. I told you.
Yes, yes, you are office work. And are you well supported by your family?
Yes, doctor.
Okay, so I don't think you need any social or economic support, do you?
No, doctor. I just need some advice on my health issue.
Okay, okay, that's all. That's all. And may I know that have you ever been on any other medication for your overweight? I think you are not that much worried about it, but may I ask you again?
No, doctor. I never seek any attention for that. I just
Okay,
came to my GP for
okay,
first time.
okay, okay. And may I know that have you ever been on to any dietitian before for this weight issue?
No, doctor. I told you that I didn't ever seek any medical attention for this.
Okay, okay, that's all right. That's all right. And may I know what your concern is?
Doctor, I actually want to know that is my condition occurring from any other disease, or can my condition lead to any heart attack or any similar effects? Because I am really worried, and especially worried about my
Yes,
children.
yes, yes. Well, may I ask you that are your children are also very healthy? May I know?
Yes, doctor, they are quite
You're quite healthy.
very
Okay,
many.
okay, okay. And may I know about your height? How much height do you have?
Yes, doctor, 5 feet and 7 inch.
7 inch. Okay, that's all right. And well, actually, as at this moment, I will have to first examine you properly, and then I can examine you and assess you properly, and then we can give you a better explanation. But as long as I have taken history, there may be some possibilities. But the most probable possibility is that actually that your food habit is maybe the main culpable issue for your overweightness. Okay, for being overweight, and also there is some family history of being healthy, and so there can be some genetic conditions involved. However, we will involve a multidisciplinary team. We will involve dietitian, geneticist, and also our consultant. Uh, so we can take a holistic approach about what investigations to be done, and what to do about it. But there are some issues that should be addressed about that. Yes, it's true that overweight persons have a greatly increased risk of heart attack. Okay, this is a fact. But so it's important that you reduce your weight, and the most important portion to reduce the most important part of reducing your weight is to have a good diet management by a dietitian. Okay, you have to a dietitian can help you in detail for mapping out a plan of your diet, and also you should undergo some regular exercise. Okay, to reduce your weight. And actually, there is no magic drug for weight reduction, and it is very important. And once you reduce your weight, I think that there your condition can also improve. Okay, hello.
Yes,
Huh. And again, there is another possibility regarding since that your menses are being a bit irregular, and you also have a predilection towards diabetes, and there can be also be an issue like a polycystic ovary syndrome. There, the female doctor, female specialist, doctor specialist can also be involved in this issue to find out whether that is the cause or not. However, all the symptoms together, I think it can be uh, due to your dietary habit, and also due to a condition named metabolic syndrome. Okay, that you also have diabetes, hypertension. These issues can be a spectrum of this metabolic syndrome. Okay, so we will find out. We will try to find out by taking a holistic approach, and then get you as soon as possible. Are you getting me?
yes, doctor.
Any more concerns?
No, doctor, you have explained everything well.
Okay. Okay. So. Hmm, yeah. 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 Okay.
Okay, doctor. So, what are the secondary causes of obesity?
Yeah, actually, the secondary causes may be due to some endocrine issues, actually, like diabetes mellitus, acromegaly, hypothyroidism, PCOS, polycystic ovary syndrome, and also it can be a part of the spectrum of metabolic syndrome, and also some genetic causes. I think Prader-Willi syndrome or something like that. This can also be involved with obesity, and I think so.
And what are the risk factors, or what are the consequences of obesity?
Yeah, but the consequences, it can be specifically more about vascular disorders, okay, vascular problems like coronary vascular disease, then cerebrovascular disease, okay, peripheral vascular disease, heart attack. Uh, I think these are the main concerns, and also uh, with obesity, there is a highly increased risk of insulin resistant diabetes, okay, type 2 diabetes, and also highly high chance of hypertension, and also problem with his blood lipid level, with the blood lipid level, hyperlipidemia.
Okay. So, what do you think the causes of obesity for this lady?
In this patient, okay, for this lady, I think there can be some possibilities. Actually, it might be also a combination of possibilities, because her dietary habit is also not satisfactory to control weight. So she can be either a person a person having metabolic syndrome. She can have PCOS, polycystic ovary syndrome, and also it can also be contributed by her dietary habit. Okay, because of sedentary lifestyle and her dietary habit, that can also be a possibility, I think.
So, how will you manage her?
Yeah, okay. At first, I would like to involve form a multidisciplinary team, and I will also involve here the the dietitian, the consultant, okay, and medicine consultant, and if needed, geneticist. And actually, the dietitian will at first map out a plan for proper dieting, okay, and she will have to maintain the diet chart, and she also have to undergo physical activities. Actually, it's better for 30 minutes walk at least 5 days a week, and afterwards, and at the same time, she will have to we will have to find out whether she is turning towards to be a diabetes mellitus patient, or about her control of hypertension. This should be maintained precisely, and also her blood lipid level should be maintained precisely. And later on, after her dietary review and all these things, if our weight is not changed, then uh, the multidisciplinary team will maybe think about going to any medication. Although there is no satisfactory medication for weight loss, but they might consider it.
So, you are talking about the lifestyle management, an exercise program,
Yes. Yes.
any stress management.
Yes. Hello.
Yes,
Yes.
okay, that is fine.
Okay.
The issue was the patient had that she is not concerned with her overweight. She is concerned with the consequences, or if she is going to have any heart attack or any serious illness due to this. What would be the answer for that?
Well, actually, although she is not having any heart symptoms, significant heart symptoms now, but I think that if she doesn't take into account her overweight issue, this might be a very uh, notorious cause for her future heart condition. Okay, and in the near future or future, she might have a severe heart attack or heart attack, which might be contributed for this obesity. So it's very important for her to control her uh, overweight, overweightness, obesity.
Okay, sure, that's fine.
Okay.
So,
Okay.
in the history taking, I think that you went for almost all the causes of obesity, secondary causes of
Mm.
obesity. You have excluded them
Mm.
well. one thing that I
Mm.
would like to mention, that you should have asked a little bit about exercise habit. Did she
Yeah.
do any exercise or any special exercise program or not? Have she ever tried that?
Mm,
That would give you a better idea that if she need any special attention or, on that lifestyle management.
Okay. Okay. Yeah. 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 Yeah.
And also, is how about her mood?
Yeah.
Is there any factor that is causing her to eat fast food? That is one factor, was that she's not getting much healthy food near at his job. Another thing that may be that she's healthy and people always make fun of her, so she always
Yeah.
embarrassed.
Yeah. Yeah.
She eat more
Mm.
on that. Another issue, that mood issue you could have mentioned.
Yeah. Yeah.
Otherwise, it was fine.
Yeah. Okay. So I think too much discussion is not needed in this case. But may I know that
I think
primarily
this case is also somewhat like uh, everything is
patient
given
four.
here. Just trying to find out if there is any secondary causes, and also educating and counseling the patient. That is a part of his
Yeah. Yeah.
patient.
Mm-hmm.
Already said that she is not worried about her weight. She is worried about any consequences. So for this, that
Mm-hmm.
if although you are not worried about your weight, but it may lead to these consequences. So
Yeah. 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 Mm.
patient welfare maintaining. And also another thing that you could have asked, that she has a history of she has family history of heart attack. So at what
Yeah.
age that happened? That
Yeah.
is
Yeah. Yeah.
previous cardiac disease.
Mm. Specifically, familiar hypercholesterolemia. That would
Yes.
have been very important.
That at what age her mother had this heart attack.
Yeah. 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 I actually missed that. That should have
Yes.
been asked.
Otherwise, yeah.
Okay.
Otherwise, everything was fine, I think.
Okay, well, something I think I would like to ask, because when I actually asked about her dietary habit, I actually included smoking alcohol actually at the same time. Is it wrong or is it okay? Because I actually intentionally did that, because I think that since I'm talking about some dietary habit, may I include all these things together?
I think, yeah, you can ask it later, because this is not directly related to the obesity.
Okay, okay. That's the thing I needed to know. Okay, and yes, that's right. Maybe exercise issues that should have been asked. This is wrong not to ask. And family stuff. I'm hyperfamiliar hypercholesterolemia. Okay,
Yeah.
that should have also been brought up. Okay.
Otherwise, if you have
And I actually I forgot another thing. I forgot to ask about her cholesterol level, whether she knows it or not, or whether there is any problem about cholesterol levels in the family. I think that should have been asked.
yes, familial cholesterol level, that you could have asked, because this patient only went to the doctor for the first time.
Yeah, yeah. So this should have been asked.
Familial
Okay.
history, you could have asked.
Mm. Yeah.
Okay, fine. Thank
Yeah.
you.
Okay. So I think that's all. Okay.